Do you frequently feel like your heart pains sometimes? Or maybe you've had a fever that just won't go away, and you feel so weak you can't even stand. Imagine that turning much worse, like sudden high fever, vomiting, and even bleeding. That's how Ebola starts. It's rare but very dangerous. It mostly spreads in certain parts of Africa, but because people travel, it can reach other places. So knowing about it isn't just for doctors, it's for everyone. Have you ever traveled to a village where people are sick with unexplained bleeding? That's why we need to talk about Ebola. What actually causes Ebola? It's not from bad air or magic, it's a tiny virus called Ebola virus. Think of it like a sneaky invader too small to see. It lives in animals, especially bats. If a bat poops on fruit and someone eats it, the virus can jump to humans. Or if you touch the blood or body fluids of an infected person, like sweat, vomit, or poop, you can get sick too. Even caring for a loved one without gloves can be risky. So the cause is clear: contact with infected animals or people. Would you hug someone with Ebola without knowing? That's how it spreads. How do you even know someone has Ebola? First, it hits fast, within 2 to 21 days. You might suddenly feel like you have the worst flu ever: high fever, headache, muscle pain, and sore throat. Then it gets scarier: vomiting, diarrhea, and sometimes internal or external bleeding. Imagine your gums start bleeding, or you see blood in your poop. The body weakens fast. Some people even confuse it with malaria at first. But here's the key: if someone has these symptoms and recently traveled to an Ebola zone or touched a sick person, alarm bells should ring. Have you ever felt so sick that even water makes you vomit? That's how Ebola feels. Can doctors test for Ebola? Yes, but not with a simple thermometer. They need blood tests, like drawing a small sample and checking for virus RNA in a lab. This takes time and safety gear because the blood is highly contagious. No quick home test exists. As for treatment, there's no pill you can swallow to kill the virus. Instead, doctors help your body fight it, giving fluids through IV, oxygen, and treating other infections. It's like recharging a dying phone battery so it can work again. In recent years, new treatments like monoclonal antibodies, like Inmazeb and Ebanga, have helped some patients survive. Would you trust a drip to save your life? For Ebola, that's often the best shot. How can you stay safe? Think of it like protecting yourself during a rainstorm. You need an umbrella. For Ebola, your umbrella is avoiding contact. Don't touch sick people or dead bodies, especially in outbreak areas. Always wash hands with soap and water. Use gloves and masks if caring for the sick. Also, there's now a vaccine, called Ervebo, that protects against one type of Ebola. If you're a healthcare worker in a risky area, getting vaccinated is like wearing a shield. Would you enter a war zone without armor? The vaccine is your armor. Communities also need to educate each other, talk, share facts, stop fear. What's new in the fight against Ebola? Scientists are moving fast. We now have 2 vaccines, Ervebo, approved in 2019, and a second one, Zabdino-Mvabia, for long-term protection. Also, lab tests are getting faster, even portable ones that work in villages. One cool advance: using drones to deliver blood samples from outbreak zones without risking more infections. Researchers are even testing antiviral drugs that may stop the virus early. Imagine a future where a quick shot or pill stops Ebola before it harms anyone. We're not there yet, but we're closer. Isn't it amazing how science turns a deadly virus into a preventable problem?